Hi, Dr. Pelto here. I want to go over some of my favorite features on Athena. What you'll see here is this is a test patient. This is one my partner previously started to fill out. My favorite features are actually more down with the technical aspects that we use, and that's going to be down here in the physical exam finding. What I really like about the physical exam, it's easy to fill out, and you can add in different templates. For example, if you want to change the physical exam template, there's different, you can do previous exams, you can pull in the previous exam really easily. You can pull in different templates, and I have some of these that are going to be, for example, nails and calluses only or wound only. So it'll keep the normal template and just add in just wound measurements and things like that, or wart or lesion measurements. So it's really easy to add things into these templates, and it'll put it in the right section. Everything else pre-populates normally. If you put in the normal values, you can do skin, you can do musculoskeletal. So I really like these components. Another thing that I like are the documentation of the procedures. So all the procedures that we do, there's 15 that are pretty common for us, and then you have all the procedure templates. So we have 112 templates. If you want these, I'm going to put a code on the bottom of this video, and you can get them. Either you can get them in Word if you don't use Athena, but if you use Athena, I'm going to put my code for my own clinic here, and then you can just ask your advisors through Athena, say, hey, could you have Dr. Pelto's transferred over? And that'd be a lot easier than you having to go through the work of refilling these all out. But basically, these are the procedures right here. There's 112 of them. Difficult things. Some are for AFOs and things like that, wounds, excision of lesions, the fracture codes, trigger point injection codes, biopsy codes, things like that, strapping, splinting. There's also codes that can be done for different procedures. So here's all the assessments. You can pick all the assessments as well. You can get all these diagnoses that we see. There's more than 10 of them. But and then point of care exams are the different exams. We do foot, heel, ankle, ultrasounds, and then we used to do fluoroscopy. We don't do that anymore. And so they're there. And then also within the actual diagnosis, there's different orders. So you can order antifungals, all these little orders. So these are my favorite things because it makes it really efficient. You have to set them up properly, but once they're set up, they work really, really well. So once again, if you want those, just let me know. I have some in Google Drive, so you can just copy and paste them yourself, or you can just ask your rep and they will transfer them over, whatever you'd like. It's fine. Also for discussion, what I really like are the dot codes. So for right now, we're doing a lot of telehealth. So it'll pull in like a telehealth template, or if you want to do like a flexor tenotomy, it'll pull in that template, or whatever discussion you want to have with the patient, it'll pull it in. If you want to talk about your wounds or CDF, like a CDFE template, like a diabetic complete comprehensive diabetic foot exam. And the other neat thing is if you start one and then you want to edit it, you can delete some areas from it. And then if you click this little button here, you can resave it as something else. It's called a macro. And then you can either just keep it in that section or another section, or you can actually edit it. So it'll pull up the words and you can edit it right in here if it's specific to a patient, you want to delete some of that. So those are my favorite not add-ons, but favorite aspects of Athena that make it really easy for you to use. So the follow-up's really easy as well. Hope you enjoy that. Okay, thank you.